Hospice care provides medical and supportive care to people facing terminal illness with a life expectancy of 6 months. Dr. Eric Moore with Advent Health Hospice is here to give us a general overview. And Dr. Moore, thanks so much for being here, because I think folks have maybe a lot of misconceptions or different ideas, or no idea actually, really what's involved with hospice. So if you'll just tell us, what is it, what does it involve, and what isn't involved in hospice?
Sure. Thanks, Carol. I like to think of hospice initially, looking at the term hospice, which was something that was coined many years ago, as a place where people that were sick or weary could come and stop and be cared for.
That's great. That's a great image for folks, yeah.
In this day and time, hospice really, I want people to realize it's not particularly a place like a hospital. It is more a service orientation for families and patients that have been given a terminal diagnosis.
Right.
So essentially, hospices come to you, wherever that might be, wherever you live, whether it be in your home, in a nursing home, an assisted living facility. Hospice will come to you and provide that palliative care, which is essentially symptom care, easing the burden and suffering of the condition that you might have.
Right.
And so hospice surrounds the patient and family with a number of services, including medical services. So you get a physician that can come out and see you. You get nurses. You get CNAs or nurse aides that come out and help bathe and do all sorts of things to help the caregivers. You also get social workers that can come and help you plan for, funerals and that type of thing.
Oh gosh.
Certainly spiritual counselors, chaplains, priests, whatever you would like. We bring all of that to the patient and family wherever they are.
And there's the magic word, family, because I think so many times the family is provided with this diagnosis, and now they know their loved one is in this situation. They don't know who to turn to. So hospice is one of those opportunities that, well, you just mentioned it. It's all encompassing, all sorts of things that are provided. Is there any kind of charge or fee for hospice? Is it covered by insurance? All those details.
That is the great thing about hospice, and one that our country has decided we want to take care of our citizens when they come to that point in life, whether they can pay for it or not.
Oh, sure.
So, of course, most patients that are on hospice are 65 and older. And of course, in this country, when you're 65 and over, you usually qualify for Medicare.
Right.
So there is a Medicare benefit for hospice so that patients don't have to worry about costs. Medicare pays for the cost of the services.
That's a huge weight on their minds, sure.
Yes, the medications, equipment, hospital beds, that type of thing, so that you don't have to worry about it. It is so important for people that don't have insurance. What if you don't have Medicare? We have a lot of people that are younger than 65 now, and certain insurance carriers have a hospice benefit. But if you have nothing, we will take care of you no matter what.
And this is it. It will have obviously all the information that folks can find a hospice agency in the Central Florida area. But maybe someone has been in hospice. Do they ever disenroll out of hospice?
Well, the great thing about hospice is the care that you get. I would say 12 years, 15 years ago, most of the diagnoses for a hospice patients was cancer. Now, with especially here in Florida, with our aging population, a lot of diagnoses, a lot of patients have dementia. And so when hospice comes in, what we're finding, the care that we provide, patients are living longer, right? And sometimes they get so much better that we actually have to discharge them from hospice. But also, your question, can a patient come off of hospice certainly. No one is held captive to hospice. If a patient feels like they want to do something different, they can certainly elect that benefit and move off of hospice and then come back on if they want to come back later.
Absolutely. Oh my gosh, what a great program. And Dr. Moore, thank you so much for sharing how hospice services can support an individual and their families at the end of life. Great information. Thank you.
Thank you.